everyone, I'm Nikki. I'm one of the respiratory nurses from the Impact Plus team. Today we are going to talk about respiratory exacerbations and medications. So what is an exacerbation? An exacerbation is a worsening of your respiratory condition. It is when your symptoms have worsened from the norm and you may need to increase the frequency of your inhalers and frequency of chest clearance. You may also need to start medications. This could be a commencement of antibiotics and either increase or start in steroid tablets. Many of you may have a rescue pack of antibiotics and steroids in which you keep at home, and you start these when it's needed. We will discuss this further, and we suggest many of you would benefit from a respiratory action plan, which we will also discuss further. Everyone experiences different symptoms which can trigger exacerbations and aggravate respiratory symptoms. Changes in air temperature, exertion, emotion, sprays, aerosols, smoky environments, and viral infections. Exacerbations can be in 3 different ways. It can be non-infective, infective, and it also can be aggravated due to anxiety as well. So infective, they usually require antibiotics and steroids medication. Non-infective, they may require just using steroids alone. And anxiety, mainly to do with breathing management, anxiety control and other techniques which you'll go through during this pulmonary rehabilitation course. So frequency of exacerbations, everyone exacerbates very differently. Some people exacerbate more than others. Reasons why you may exacerbate more is if you continue to smoke, during the winter months when it's cold, and as your disease progresses. You cannot stop yourself from exacerbating. However, you can reduce the amount of exacerbations that you are getting. These can be making sure you keep your hands clean and wash them regularly. Avoiding other people with colds and coughs and making sure you keep your distance if you know someone is unwell. Keeping yourself healthy and by making sure you are eating well and regularly throughout the day to keep your energy levels up. If you notice you are losing weight, ensure that your respiratory nurse or GP is aware. You may need additional support from a dietitian to make sure you stay healthy. There are numerous ways in which you can keep your nutrition intake up. Making sure you are sleeping well. Keeping active. We always say once you are not using it, you lose it. It is very important to keep yourself moving. If breathlessness is limiting your activity, there are numerous breathlessness and pacing techniques to ensure you keep moving, which we can always help you with. Making sure you've had your flu and pneumonia vaccination. Your pneumonia vaccination is usually a one-off jab. If you're unsure you've had one, please contact your GP. To keep you well, it is important to make sure you are also taking all your respiratory medications and taking them as prescribed. To help you with recognising an exacerbation, it is important to have a respiratory action plan, which we are happy to provide you with and go through individually with you if needed. The respiratory action plan is a plan that all individuals with a respiratory condition should have. This helps you self-manage your own condition and recognise when you need to increase or start your medication. In the action plan, this is usually the green section, and this is when you are stable. It highlights your usual symptoms and what is normal for you when you are well. How breathless are you usually when you are well? Do you bring up phlegm usually? If so, what colour is it? Is your cough daily? Is it usually dry or is it productive? And if you take an inhaler, how often do you usually need to use it? Is it normal for you to have aches and pains in your chest? Be aware what is normal for you. If something isn't normal, you may be exacerbating. In the respiratory action plan, the next section will be the amber section. This highlights what you do when your symptoms are different from the norm. You may have increased breathlessness and reduced walking distance. For example, you're usually fine walking from your front door to the road, but now you're feeling more breathless. Increased sputum production, and this may have changed colour. Increased wheeze or chest tightness, and you may be using your reliever inhaler more than usual. To treat exacerbations, you may just need to increase the use of your reliever inhaler. This is usually your blue inhaler, salbutamol inhaler. you may need a course of steroids. So the steroid tablets, which are usually prednisolone, this reduces the inflammation that's going on in your lungs. We usually give either 6 or 8 tablets for 5 to 14 days. If it's a chest infection, you may also, as well as the steroids, have to have an antibiotic, which is usually doxycycline or amoxicillin. Also, during an exacerbation, you will need to ensure you increase the frequency of your chest care, chest clearance and breathing control. If you do have an exacerbation or may feel like you have an exacerbation, we have an advice line. This is called the lung line. The next section of a respiratory action plan is the red section. This is when your condition has worsened and you may feel quite unwell. This may be that your symptoms are getting worse despite being on your steroid or antibiotics. You feel like you have a fever, so this may be that you're shivering, feeling really hot or cold. You have new or increased swelling to your feet, ankles or legs. If any of this is happening, then please contact your GP or 111 out of hours, or of course call the lung line. If you are extremely short of breath, unable to speak in full sentences, you have any confusion, drowsiness or any chest pain, then please call 999. This is an example of the respiratory action plan that we can provide you with and go through individually. The benefits of a respiratory action plan is to ensure that you can self-manage your own symptoms and start treatment early. This allows faster recovery, improves quality of life and reduces hospital admissions. Main pointers is to be aware of your normal symptoms. Know what feels normal for you. Remember that you can have good days and bad days, and your symptoms may deteriorate over 24 to 48 hours. Try to contact your GP as early as possible, and antibiotics may take 24 to 48 hours to work. If there's no improvement, then please seek further advice from either GP, from ourselves, or from 111. When you are feeling breathless after any physical activity, anxiety or stress, fan therapy can be a very effective way to help with breathless management. Ensure the fan is on your face, usually pointing at either cheeks, and that will help you calm your breathing down. Not all of you will be on inhalers, however these are a few that we're going to go through. A very common inhaler is your salbutamol Ventolin inhaler. This is usually a blue inhaler and this is your reliever inhaler, so you use this as and when you need it throughout the day. Usually starts to work within 3 minutes and can last up to 4 hours. It's good to be aware of some of the side effects these may cause. Some of you may be on a Braltus, Spiriva or Respimat. These are bronchodilators and help keep your airways open throughout the day. They usually last for 24 hours. These inhalers are examples of bronchodilators. You usually take them once a day and they last for 24 hours. Common side effects are listed on the slides. This is a combined inhaler, which is also a bronchodilator. You usually take this one once a day and this lasts for 24 hours also. Common side effects are listed on the slides. These are steroid inhalers. This helps to reduce the inflammation in your lungs. Common side effects can be oral thrush, dry mouth. Therefore, it is very important to, whenever you use an inhaled steroid, to wash your mouth out after using. These are examples of other combined inhalers. This is a bronchodilator with a steroid component within. It is important, if you are on these inhalers, to also wash your mouth out after using. Other respiratory medications. Mucolytics. Example are carbamazepine tablets. You usually take these when you struggle to clear your chest of the phlegm. It may be that your phlegm is quite sticky or thick. Using these will help thin the phlegm and make it easier to bring up. Common side effects are listed on the slides. Spacer devices. When using an inhaler, it is really important to also use a spacer device. Not all inhalers can connect to these spacer devices. However, if you have a PMDI, which is a pressured metered dose inhaler, you should also have a spacer connected. Why use a spacer? These pictures demonstrate the importance of using a spacer device with inhalers. The white represents the medication. The picture on the left, you can see this is when someone does not use a spacer. So the white medication tends to stick in people's mouths and they swallow it, and it tends to go into the tummy, and only small parts of it actually reaches the lungs. The right picture shows when someone uses a spacer device. This, you can see the white medication reaches more parts of the lungs. A haler aid. This is used with an inhaler when you struggle to push it down. Some of you may be on nebulizers, or some of you may have had nebulizers when admitted to hospital. They are usually used in acute exacerbations and if someone is unable to use their inhalers. However, there are disadvantages. It does need regular cleaning. It can affect the quality of life. There is increased side effects and you can become dependent on these. Other medications that you're on are listed on the slides. These may be bone-sparing medications such as alendronic acid or vitamin D tablets, antidepressants, analgesia, nicotine replacement therapy, morphine, or montelukast. Thank you for listening to this presentation. If you have any questions, please do not hesitate to contact us on the Impact Plus Lung Line number. Thank you.